Good morning and hello to one and all. I welcome you to my channel. Today the topic of discussion is deep bite, which is included in the subject of orthodontics. Deep bite basically is nothing but excessive overlap of maxillary dentition over the mandibular dentition. According to the definition by Dr. Sridhar Prem Kumar, deep bite is a condition of excessive overbite, where the vertical measurement between the maxillary and mandibular incisal margin is excessive when the mandible is brought into centric occlusion. Whenever the mandible is brought into centric occlusion and we check whether the maxillary and mandibular overlap in the vertical dimension is correct or not. In the vertical dimension, if we see if it is more than 1 to 3 mm, we categorize those patients under deep bite cases. And under deep bite, we have two major classes, that is skeletal deep bite and dental deep bite. In skeletal deep bite, usually the skeletal components are at a discrepancy, whereas in dental cases there are different dentitions because of which there is a deep bite. Let's see the features of skeletal deep bite. Skeletal deep bite is something which is related to the alveolar bone. And coming to the first point here, there is deep curve of spee in mandibular dentition. What is curve of spee? Curve of spee is nothing but a curve which is extending from the cusp of the canine to the buccal cusp of premolars and buccal cusp of molars and then extending towards the condyle. There is a curve which is extending like this. So whenever there is a deepening of this curve, there is some kind of discrepancy, because according to the Anglo 6 keys of occlusion, the curve of spee must be flat. But here we can see there is a deepening of curve of spee. In compensation to this, there is a reverse curve of spee in maxillary dentition. Coming to the third point, when there is maxillary excess. Maxillary excess is nothing but the maxillary part is coming downwards and coming into the parts which are in the smile line of the patient. The smile part where the teeth are exposed, even the gums are getting exposed in this process. That is known as the gummy smile, because the maxillary part is coming downwards and there is maxillary excess here. Coming to the fourth point, lower facial height is less. It is supporting the third point because maxillary part is coming downwards and mandible stays in the same place. And the maxillary part is exposing or covering the mandibular part a lot, extending more than 1 to 3 mm, which shows there is lower facial height is becoming less. Lower facial height is becoming less because maxillary part is covering a lot. Coming to the dental deep bite and the causes related to this. Coming to the first point, premature loss of permanent teeth causing lingual collapse of anterior teeth. When the permanent teeth are lost, naturally the anterior teeth try to come to cover the space towards the posterior side. When they come to the posterior side, the lingual collapse is seen. Or lingual side also they start coming to there. And due to this process, the maxillary dentition comes downwards to occupy the space which is left after. Coming to the second point, anterior tipping of posterior teeth. When the anterior part, the posterior teeth comes, there is a loss of vertical stop at the posterior direction. The more we go posteriorly, the more vertical stop it is getting, the dentition is getting. But when they come forward due to this anterior tipping, that is naturally lost in this case. Coming to the third point, infraocclusion of posterior teeth. Infraocclusion is, it is directly stating that when the posterior teeth are coming downwards and the maxillary teeth is coming compensating for the space, we see even in the anterior direction we see overbite, even in the posterior direction we can see the overbite. Infraocclusion of posterior teeth. The causes of infraocclusion of posterior teeth, one of the causes is tongue thrusting. It is not allowing the teeth to erupt at the natural position where it should be there. Coming to the fifth point, occasionally deep bite due to large size teeth. Yes, large size teeth occupy more space in the vertical dimension, and when they are occupying more space in the vertical dimension, so there is excessive overbite and it is called deep bite. Coming to the treatment modalities used while treating deep bite cases. Coming to the first one, intrusion mechanics. Intrusion mechanics can be done by three various things, that is burstone intrusion arch, second one is utility arches and reverse curve of spee. Reverse curve of spee is a preformed arch wire which is used in mandibular posterior teeth to flatten the curve of spee. The curve of spee in deep bite cases is usually deeper, and now we want a flat curve of spee. In these cases we use reverse curve of spee. Coming to the second one, which is relative intrusion. Relative intrusion is done using functional appliances. Functional appliances such as Frankel or activator, these are the functional appliances which we use to relatively intrude the teeth. Relative intrusion means by extruding posterior teeth and intruding anterior teeth. Coming to the third one, which is extrusion using anterior bite plane. Anterior bite plane is a bite plane which is placed at the anterior teeth portion, and by placing this anterior bite plane you get space at the posterior region. Because there is a space in the posterior region, the maxillary teeth try to extrude themselves towards the space, whereas the mandibular teeth also try to extrude themselves. There is a supra-eruption of maxillary and mandibular teeth corresponding to the space which is present there, and by extruding this teeth there is a closure of space after a period of time. Then the thing which we want, the correction of deep bite, is done.